I can remember just sort of concluding that telephone conversation and kind of just feel the energy draining through my body. This was like a new ball game altogether.
I was so shocked at first. Then how come I've got this thing?
They must be not afraid to go to the hospital.
TB is with us as long as we know it's in the Egyptian mummies, and it will stay with us, because that's what makes TB bacteria unique, that they have developed the capacity to live in our body till we almost die.
Doctor, patient, researcher. These are the faces of the entwined epidemics of HIV and TB in South Africa. HIV and TB have devastated South Africa since the 1990s. Across the nation, HIV infects more than 5 million people. The picture in the province of Kwazulu-Natal is even more stark. The world woke up in 2005. Rural Tugela Ferry and the Church of Scotland Hospital became the epicenter for an outbreak of a virulent, drug-resistant form of tuberculosis. The cataclysm in Tugela Ferry demonstrated how much doctors, researchers, and public health workers needed to learn. In turn, the province of KwaZulu-Natal has become an epicenter of a different kind. The epicenter for efforts to better understand, diagnose, and control HIV and TB. The lessons learned here will also reverberate around the world. The dual epidemic demands action on many fronts, many players, and a variety of approaches. It requires basic health education for children and adults, access to effective medicines and better health care, integrated clinical and discovery research that will yield new diagnostic tools, drugs, and treatment approaches. Education takes many forms. Near Edendale, community outreach leader Janet Froelich begins with children.
You go out and come back and tell us the story of what's happening in your community through pictures. And so these are some of the pictures which came back to us, playing a game of cards, but you can't really pick it up, but there's a red ribbon on the back of the card. And for them it was rather to spend time in the afternoons at school instead of having to go home where there was so much illness.
Edendale Hospital's iTeach program uses mobile phone ads and text messages to promote testing and send clinic reminders. Whiz Kids United reaches school children through soccer. A home test kit allows people to learn their HIV status in privacy. Krista Dong helps nurses and healthcare workers learn how to better manage busy clinics and hospitals.
So it doesn't take more nurses. It actually doesn't take more money. It just takes good supervision and a good program.
The bustling city of Durban, the largest port in Africa, is a world away from Tugela Ferry. A commercial hub, it's a mecca for South Africans seeking work and a destination for refugees fleeing instability elsewhere on the continent. Many find their way to the Prince Cyril Zulu Communicable Disease Clinic, the Durban Chest Clinic for short. They may come coughing or worried about weight loss. They may leave with a diagnosis of both TB and HIV.
When we first started seeing patients in 2000, I think we were seeing 5,000 patients a quarter. We now see 18,000 patients a month. Yeah.
We do about 100 to 240 specimens per day, every day.
Doctors like Kogie Naidoo, who also heads treatment research for the Center for the AIDS Program of Research in South Africa, or CAPRISA, are finding successful new approaches for treating HIV and TB at the same time.
More than 90% of all TB presenting to our facilities is TB that is occurring in individuals that have had TB in the past. So you have a large population of individuals in crowded facilities accessing HIV care in a background with in a high TB prevalence background.
Research in the face of overwhelming clinical demands is a necessity. CAPRISA's Natasha Samsunder runs a nationally accredited lab that collects data and samples from all over the province, a resource for today and for the future.
Here in research, you're actually making an impact in people's lives. You're somehow or the other along the way going to be maybe not finding the cure, but working towards it in little baby steps.
Physician Doug Wilson balances his work caring for TB patients at the state-run Edendale Hospital with laboratory research. He's focused on discovering a test that will diagnose the most challenging patients of all, the ones who present with symptoms of TB but fail all the standard tests. At Durban's McCord Hospital, founded by missionaries a century ago, physician and researcher Henry Sunpath has a mission of his own, working toward new TB diagnostics and treatment paradigms for patients with both HIV and TB. And at the Nelson R. Mandela School of Medicine, Dean Wim Sturm collaborates with scientists around the world in the development of a rapid diagnostic test for TB, widely regarded as fundamental to gaining a foothold against TB, HIV co-infection. Also essential, says Sturm, is finding new drugs to treat multi-drug resistant TB.
There are a few drugs in the pipeline and everybody is waiting till they come out, but the problem is, and nobody talks about that, is that one drug is not enough. Because our XDR strains, you need 3 effective drugs to treat TB, all apply them at the same time.
These challenges have and will continue to mobilize researchers around the world.
30 years ago, we could have never predicted. We thought TB was in hand. HIV wasn't even a blip on the horizon.
It's also a global problem, but it's first and foremost an African problem. And I think that we do need to change the face of the people that are doing the science. And I hope that in 20 years from now, we can not only make a really significant progress in terms of reducing infections, and hopefully we can have a vaccine by that time in reducing TB and other co-infections, but also have Africans participating actively at the cutting edge of research.
It took Tony Mull, Wim Sturm, and scientists from Yale University to identify extensively drug-resistant TB in Tugela Ferry. And their efforts, joined with many others, will be needed to find the solutions for South Africa and the world.